Hello and welcome to COVID-19 Local Impact Peterborough. I'm Dan Malta here at the Your TV Peterborough studios, where we'll be changing gears for the foreseeable future. We won't be doing shows like Politically Speaking anymore. Gone are Peterborough Petes games, Peterborough Lakers games. We don't know what will be next, so we're shifting gears just like the rest of the community. We'll be bringing you a culmination of all the important news from community leaders and representatives and giving them to you in the most efficient way possible in an hour-long show at 4 p.m. Monday through Friday. Now, part of this is going to be the daily briefings from the Peterborough Public Health Unit. Let's head to today's briefing right now.
Good morning, everyone. So I'll start with a situational update. We've had 2 new cases since our media scrum yesterday. That brings our total to 5 confirmed cases for Peterborough. We have 1 female with a travel history and 5 close contacts. She is in self-isolation at home and is improving. And we have 1 male who attended the Edmonton Bonspiel. We are currently doing contact tracing, and he is in self-isolation as well. So the condition of our cases, we have none of our confirmed cases have been hospitalized. All remain in self-isolation. We also have some data as far as how many people have been tested in Peterborough. We have 428 people who've been tested. We're testing here in our own facility about 11 or 12 people ourselves each day, and our nurses are referring to the community paramedics as needed. We have received results on 140 of our people tested who are negative, confirmed negative, and we are still awaiting results for 283. So many people still under investigation, but everyone who is tested is asked to remain in self-isolation at home. I think this is a great time to emphasize the fact, given that both of our 2 new cases are returning travelers, 1 from Florida and 1 from the event in Edmonton where we know there's been documented transmission, that travelers need to be self-isolating, and so we're asking all travelers, regardless of whether it's from outside Canada or from a place in Canada where there is local transmission occurring, we need you to take an abundance of precaution and to go home and to stay at home. Do not shop. Do not invite friends over. And visit our website for the self-assessment tool, or call Peterborough Public Health for assistance if symptoms develop. Anyone with mild symptoms and no underlying risk for more severe disease is advised that you can stay at home safely. Our community paramedics are being dispatched to assist with testing people in the home. Our nurses are directing those who can safely come into our clinic to come here for testing, and people who require a medical assessment or who may need hospitalization are being directed to the hospital's assessment center. We can navigate you safely to wherever you need to be. So for the majority of us, that will be to stay at home. And so we have prepared a new fact sheet for people returning to Peterborough, and we are seeking help from the media to direct people to our website to read it, to download a copy. Certainly, if they have friends who are returning or parents who have returned, share it with them. Perhaps concerns that a neighbor should be self-isolating and isn't. Please share this with them or ask them to go to our website to read it. And we do have it up here on the screen. Right there. I'm going to put copies on the table here, practicing social distancing here. We'll leave it there if you'd like to take a copy. So we're hoping that this new fact sheet will help both our returning travelers as well as those who are here and are concerned about the risk that returning travelers are presenting to the community. So I am happy to answer questions either on our new cases or on our new tool for returning travelers, but I do want to make sure we give Mayor Therian the time she needs to make her important announcements. Thank you.
Okay. Okay, thank you, Dr. Salvatierra. So is Mayor Therian on the line?
Yes, I'm here.
Oh, great, excellent. The audio is good here, so I'm going to turn it over to you to please make your announcement.
Okay, perfect. Thank you very much. And so we've had staff working really hard, obviously, over the last couple weeks. One of the questions that we know we've heard a lot about is the shelter system and folks who are in those spaces, which are not obviously conducive to social distancing or social isolation. So we have secured space at the Peterborough Sport and Wellness Center that will be used for emergency shelter space. And the Brock Mission and the Overflow Shelter Bed Program will be temporarily relocated to areas within that Peterborough Sport and Wellness Center. It may also be used as secondary shelter space for Cameron House and the Yes Shelter for Youth and Families if needed. So again, we're encouraging people to practice social distancing. You're not able to really do that in the shelter system as it is now. So at the Peterborough Sport and Wellness Center, there's more space for folks to sort of spread out. And of course, housing remains the best way to help folks in general and in the face of COVID. So we have had 275 shifts from homelessness into housing over the past year. That continues to be a focus, but recognizing that in the interim, we need to have more space available for people to spread out a little bit. And Commissioner Laidman's on the line to answer more specific questions about that. And that should be, he can correct me if I'm wrong, but we should be having that open tomorrow for people to be staying in.
And now we have a message from the Mayor of Kawartha Lakes, Andy Letham, as he announces a state of emergency.
Good morning. Today, March 24th, the City of Kawartha Lakes has officially declared a state of emergency. So what does this mean? It enables us locally to deploy resources to assist frontline healthcare workers and partners and support emergency services to support the COVID-19 pandemic efforts. For example, our paramedics will be mobilized to assist the hospital to do at-home assessments. This relieves the pressure on our frontline healthcare workers while allowing patients to stay at home if required and isolate. And as things continue to change and escalate, we will have the flexibility to reallocate local resources as needed as a community. This declaration puts us in alignment with the province. We completely support the tough decisions they're making at the provincial level. It's not about federal, provincial, or municipal levels of government anymore. This is about having a complete community response. We can now help our partners as needed to contain this virus on all levels. Everyone needs to self-isolate until April 5th, wherever possible. To those who are following the guidelines, I say thank you. As difficult as I know this is, you need to know you are saving lives. For the ones that aren't following the guidelines, wake up. I can't stress enough that now is the time for everyone to heed the warnings and follow the instructions from our medical officer of health. Self-isolate, do not visit long-term care homes, and continue to keep physical separation. Keep washing your hands. Tomorrow, an announcement will be coming out with further service reductions and relief for residents and businesses. We know many are struggling, and we are ready to support and work with you to get through this. These are unprecedented times, and we need unprecedented cooperation. I'm counting on you as members of the Kawartha Lakes community that by working together, we will get through this together. Thank you.
And Peterborough and Kawartha MPP Dave Smith spoke earlier today about the impact local businesses are having in a trying time.
Thank you very much, everyone, for joining. I really appreciate this. This is the first time that we have tried doing a press conference this way, so please bear with us if there are any little hiccups as we go. As you know, COVID-19 has really embraced our province. We are in a situation right now where we're on a precipice where we could go down the path where it becomes a major challenge for this province, or if we do some of the things the right way, we'll find that we're able to reduce the rate of infection, and that's what we're trying to do. Over the last 24 hours, a number of things have changed in Ontario. I'm going to start with some of the announcements from Sunday. On Sunday, we made a change to our healthcare system. And what we did there was we suspended some of the collective bargaining agreement provisions that were in there so that we could redeploy healthcare professionals into different areas of healthcare without the delays that we would need under the current system. Just as an example, if somebody wanted to move from one department to another department, it's about a 3-month, possibly 4-month process, and it could include bumping rights. That's not something that is going to be effective as we move forward dealing with COVID-19. So we are suspending some of those collective bargain agreement items so that we have the ability then to move healthcare professionals into the areas where they are most needed in a timely fashion. We don't want to be in a situation where we're short on nurses, we're short on doctors, we're short on personal support workers because the system doesn't allow for us to move people into the areas where we need that extra help. Today, Minister Rickford made an announcement with Premier Ford about Ontario hydro rates. We've heard from a number of different people that with them being self-isolated, they will be using more electricity during the day, and they had asked for some relief on that. One of the things that we have done today then is we have changed the time of use rate so that it is the lowest rate, and it will be that way for the next 45 days. We'll be reviewing it every 14 days. The way that the Emergency Act allows us to do things is to do it on 14-day increments. We're committed to the next 45 days of keeping hydro rates at the lowest amount, and that's because we recognize that a number of people, when they are self-isolated, are not going to be able to be working to bring in the income that they would have had previously. This is going to put some strains on them. And if we can reduce their electrical rates, their gas rates, and ensure that their hydro and their gas can't be cut off, this is something that I think is going to provide relief for everybody in Ontario. Yesterday, Premier Ford announced that we will be shutting down non-essential businesses. The list of essential businesses was released late last night. Most people have reached out to our office. A number of people have reached out to our office to ask for clarification on it. And there have been some questions about some of the groups that are part of this. When you look at supply chain, just as an example, you may be questioning why is, and I'm using some of the examples from Mayor John Tory, you may question why is a glue factory considered an essential service. It's not necessarily the glue itself is essential, but the glue may be used by the box factory. The box factory is producing boxes for hand sanitizer. So when you do it down chain and you look at it, it does start to make a lot of sense why some of those things have been done the way that they have been done. Ultimately, Ontario is in a position right now where COVID-19 could become much worse, or it could be stabilized. We need to have as many people practicing social distancing, social isolation as possible. We have to slow the spread of this disease. There is no natural immunity to it. People, when they come in contact with it, have a high likelihood of contracting the disease, and we want to make sure that we slow that down. Our hospitals have a certain capacity, and we don't want to be in a position where we are over capacity. So we're asking everyone, please take these measures. Help us slow the rate of infection down so that Ontario can deal with this in an expedited manner.
Big news for sports fans as the Peterborough Petes season is officially done. The entire CHL done. The Memorial Cup will not be played for the first time in 102 years. We had a chance to speak with Peterborough Petes President Dave Pogue. On the line we have Peterborough Petes President Dave Pogue. Dave, obviously a tough piece of news that came down today, finding out that the season, the regular season, the playoffs, the Memorial Cup aren't going to be happening. For you, just take me through what it felt like when you actually heard the news.
Well, I was, along with our team governor, Dr. Bob Neville, with the two of us were on the governor call yesterday, the OHL Board of Governors call, and you know, I had an idea when we were asked to dial in what it was going to be about, but it's very surreal. I was a little surprised that this would happen this soon. I guess, as you know, I'm an optimist, but I also thought that, we'd be able to wait things out at least another month or so to see where we're at. I guess the health officials obviously are telling us things are going to get worse before they get better, and that, you know, a month isn't going to make a big difference. And I think the cancellation of the Memorial Cup due to the rulings out in British Columbia, where groups can't get together before the end of May, and that's of course when the Memorial Cup was on, really was putting the writing on the wall and was inevitable. But nonetheless, when reality sets in, it's been very, very disappointing for our group at the Petes.
And going forward as an organization, what level of normalcy do you hope to be able to continue throughout the off season to try and build towards next year?
Well, normalcy, we're not sure if anything's normal right now, in or outside of the office. Of course, all of our business staff is working from home. The players were sent home a while ago. Our hockey operations group, we're working at the PMC. The PMC officially is shut down, locked down today, so not even the coaches can get in. So yeah, our focus was really working towards some sort of a semblance of a playoff against Mississauga. That's where the hope was, and that's where the preparation was for the hockey department. Mike Oak, of course, and his group were preparing for the draft, which is still set for April 4th. And that's, the one piece of good news and the exciting thing that we can talk about. And the business group, we're working towards selling playoff tickets. That will obviously change, and they'll change their focus to next season. But we also recognize that today is maybe not the exact day to phone up people to ask them if they're interested in buying a season's ticket. We will be looking at the financial end now. That's going to be the big thing. We're taking account of our finances. We've got, we'll be zeroing in on our accounts receivable, getting that money in, and starting to look at what we have to do as a business to work our way through and maneuver through the summer, like many small businesses are in this unprecedented time.
And there will forever be a sense of incompletion regarding this season, but how would you rate it on the whole, as it is now completely done?
Well, we're very, very proud of what we achieved this year. We're very proud of the team and the group and the work that was put in. And yes, it does feel very incomplete. It feels like we've got unfinished business. No doubt in my mind, no doubt in the coach's mind, the players' minds, especially on those last 4 games we had, the whole mindset that you could feel in the building was that the confidence had built to the point where we really felt we had the ability to take on any foe in the OHL, and we really felt we had the ability to beat on any given day any foe in the OHL, which we thought we had a shot at the championship. But the foe we didn't count on was coronavirus, and that seems to have at this particular time beaten not only us but the whole league.
Dave, thanks for your time.
Thanks a lot. Bye-bye.
Now from Cogeco News in Muskoka, hypnotherapist Warren Broad speaks about how stress management is obviously important at this point in time and how to manage it for our youth.
Well, I think what's most important in all of this is understanding the age category. So for our kindergarten children, our basically our pre-grade 1 children, primarily it's more about parents paying attention to their own mental health and to their own behavior, because children that are high level of linguistic ability understand their world through the adults that surround them. So the behavior of the adults around them is how they determine their own behavior. So the more anxious we are, the more disruptive things seem to the children around us, in particular young children. That is how they determine whether there's a problem or not, because their linguistics aren't quite there to understand. We can use terminology of, it's a bad bug, it's a nasty bug that likes to travel around. They can get some basic understanding on that, but primarily the way in which they're understanding the nature of this problem is through the adults that surround them. So the more calm that we stay, and in particular, the more that we stick to normal routines, sticking to breakfast when breakfast is normally served, having nap time when it's normally nap time, doing things as normally as possible is how we manage the anxiety that may be transferred or maybe perceived by the kids that we're taking care of. The teens really don't quite understand this, but just in a slightly different way, in that they're not highly impacted by it. If they have a job, if they're a teenager where they do have a job, perhaps they've been asked to stay home, and they might understand that some of the gravity of that. For most of the teens that don't have jobs or work, there really isn't yet any real significant impact for them. So it's trying to reinforce to them staying clean, washing their hands. But again, they do still feed off the perception of what they see their parents going through. So the calmer we stay, really the better. The challenge where we're going to see some mental health difficulties or differences is really in that middle range. So they're not fully teenagers yet. They're not kindergarten or even grade school. They're right in that middle school area, and they will see significant impact, just in the sense that the programs that they might have been involved in, if they were doing day camp or if they were doing things of that kind, and obviously they can't go back to school, they will see probably the most amount of disruption. So for them, it is having a semi-adult conversation of we're okay, everybody really is okay, obviously not those that are vulnerable, but that reassurance is important. Trying to keep them busy, give them household tasks, give them things that they can be proactive in trying to be part of the solution. This is always a good thing for children, to give them the ability and reinforce to them that, even if you give them a task of cleaning their bathroom, that was helpful, and reminding them that they've been helpful and that staying clean and doing all the necessary measures are part of the whole process. So it's an empowerment thing, because where that middle ground tends to have challenges is that they feel disempowered, or they feel that they have no ability to help. And giving them positive reinforcement that they are helping is really significant and very helpful to their mental health.
Thanks for tuning in to COVID-19 Local Impact Peterborough on your TV. We will be doing the best we can every day at 4 p.m. to bring you all the information you need to stay safe and keep your loved ones safe. For now, take care of each other. We'll see you tomorrow at 4 p.m.